Mr. Louis Ng.
Madam Deputy Speaker, may I address questions 12 and 13 together?
Go ahead.
My answer will also address question 36 for written answer from today's order paper, questions 20 and 21 for oral answer, and question 53 for written answer raised by Mr. Ng from the order paper on 1st August. Thank you, Mr. Ng, for your concern over our nursing workforce. I believe it's also not too late for me to wish all nurses in Singapore Happy Nurses Day. Over the last 5 years, there has been a slight overall increase in the attrition rates for local nurses. The attrition of local public sector nurses increased from 6% in 2017 to 6.3% in 2018 and 7% in 2019, then dropped to 5.4% in 2020 before increasing to 7.4% in 2021. For foreign public sector nurses, international competition has been more intense and attrition rate has increased more significantly from 8.2% in 2017 to 9.1% in 2018 and 9.4% in 2019, then dropped to 7% in 2020 before increasing to 14.8% in 2021. The typical nurse-to-bed ratio for general wards in the public acute hospitals is 1 nurse for every 4 or 5 beds. The typical nurse-to-patient ratio in the intensive care unit, ICU, in the public acute hospitals is 1 nurse for each ICU patient and could be higher, such as 2 nurses for more complex ICU cases. This has not changed significantly over the past 5 years. Mr. Ng had asked for salary comparison between private and public hospital nurses. We are reluctant to provide this so openly as we know that both sectors compete for manpower. We also do not have the data for the private sector. I will, however, share a few data points. Staff nurses, SNs, and senior staff nurses, SSNs, form the largest proportion of our nursing workforce. The median annual salaries for SNs ranged from $42,800 to $53,700 in 2017 and rose to $46,300 to $58,500 in 2021, while that for SSNs ranged from $65,000 to $79,700 in 2017, increasing to $71,200 to $87,600 in 2021. In general, it takes an average 4 to 6 years for a fresh graduate to move up to SSN. Hence, an SN in 2017 may be drawing the annual salary in the SSN range by 2021. The key issue is to retain the services of nurses. Our strategy to stabilize the nursing workforce covers several key aspects. These include reviewing the scope of work that nurses are doing to enable them to spend more time on direct patient care. Equally important is to ensure remunerations are competitive, locally and also internationally. On reviewing the scope of work, our public healthcare institutions adopt a multi-pronged approach to reduce the administrative workload for nurses and enable nurses to focus on patient care. This includes streamlining care processes and deploying dedicated administrative and support care to assist nurses. Over time, we have also introduced innovations in automation, technology, robotics, and AI-enabled technology to assist nurses and healthcare staff to ease the load of non-clinical and administrative tasks. An example of such technology is the nursing software suite introduced by Singapore Health Services, SHS, in their hospitals to enable patients to self-help, such as enabling them to check their results, medications, schedules for tests, and indicating their requests to the care team. Other than reviewing the job scope and administrative workload, as our population ages, there will continue to be growing demands on healthcare manpower. I also urge families and caregivers to be a partner in the care journey of your loved ones, as working together with us will help alleviate the workload faced by our healthcare staff. Mr. Ng also asked if the National Wellness Committee for Junior Doctors, NWCJD, could broaden its scope of work to include the working hours and conditions of nurses. We would like to explain that the NWCJD was formed to specifically address issues related to junior doctors. These need to be tackled differently in the case of junior doctors because of their regular rotations across the public healthcare system compared to other staff groups who are employed directly by the respective public healthcare clusters. MOH and the public healthcare clusters have always been concerned about the well-being of nurses and other staff groups. For example, we had formed an internal cross-cluster staff well-being committee in 2019 for clusters to share best practices with each other and provide feedback to MOH on enhancement to improve staff well-being across all categories of staff. One example of its recommendations was for MOH to look deeper into the issues of abuse and harassment of healthcare workers. Hence, we announced earlier in March 2022 the formation of a tripartite work group to address this nationally. Clusters have also enhanced the support measures for staff. For example, chief wellness officers have been appointed by clusters to oversee and develop system changes to improve the well-being of all healthcare staff. Counselling services, peer support networks, and staff support assistance plans have also been put in place to support staff. The rest day provisions and work hour limits for public healthcare workers are stipulated in the Employment Act or set out in the public healthcare cluster's employment contracts, as previously explained to Mr. Ng in Parliament in March. While the Ministry does not impose a minimum number of rest hours, duty rosters for nurses are planned in advance to ensure staff have adequate rest between shifts. Even as we prioritise the well-being of our nurses, we appreciate the reality of their work, which is to deliver timely and quality patient care. The Ministry is working to ensure that there are sufficient nurses on the ground. In fact, the registered stock of nurses over the past few years has remained stable, with a slight increase from around 42,800 in end 2019 to 43,000 in end 2021. Local nursing intakes have also increased from around 1,500 in 2014 to around 2,100 in 2021 to ensure that there is a stable inflow of nursing manpower into our healthcare system. We understand the importance of recognising nurses' contributions, and the Ministry has worked on reviewing their salaries and allowances. Over the last 5 years, the annual salaries of local nurses in public healthcare institutions, which comprises base salary, allowances and bonuses, have increased. With the easing of COVID-19, public healthcare institutions have been allowing nurses to take time off work to rest and recover. This includes allowing foreign staff to return home to spend time with their loved ones after a long period of time away from them in 2020 and 2021, when many borders were closed and travel restrictions in effect. We know from clusters data that leave is being approved and allowed. MOH remains committed to provide support to the public healthcare clusters in our efforts to ensure that there is sufficient manpower on the ground and look after the well-being of our nurses as they continue to face pressures from COVID-19 surge waves and an ageing population.
Mr. Louis Ng.
Thank you, and I thank SPS for the reply, but I have 3 clarifications. One, I think SPS mentioned that the nurses should have adequate rest, but I'm just wondering whether MOH can really clarify what does adequate mean. I think a lot of nurses are sharing that sometimes they end the shift at 9 or 10 p.m. and then they're back at work at 7 a.m. and that really is insufficient rest for many of them. 2, could I ask whether MOH has an ideal nurse-to-patient ratio, and what are we doing to work towards the ideal ratio, both again in the general wards and in the ICU as well? And I think lastly really is the ancillary care stuff that I asked for the median salary as well, but I understand we can't provide that, but I think they do help in reducing the nurses' workload. So if I could ask SPS, what is MOH doing in terms of increasing the salary of the ancillary care staff, the career progression, as well as increasing hiring of these staff members? Thank you.
SPS.
I thank member for the question. There are many different, let me address the first one first in relation to the rest hours. There are many different arrangements within the public healthcare institutions in the different clusters on how they actually manage the healthcare, rest hours within the healthcare workers. So in some clusters, it is about actually ensuring that they typically work on rotating shifts and they are rostered such that they have adequate rest time within shifts. Guidance have also been given so that they are actually given rest time for their breaks. Duty rosters are planned in advance, and there are guidelines so that they are not working consecutively beyond a certain number of days so that they get the rest they needed. Within the working space, they are also given dedicated call rooms, staggered break time so that they can have sufficient rest. The reality on the ground is that there are many challenges, and these nurses work very hard. There are realities of their workplaces that requires them to actually go beyond their call of duty. We really appreciate that, and we know that it's been challenging for the nurses and all the healthcare workers. So the key thing is really making sure that there's sufficient number on the ground, and that's something that we're continually looking at. The attrition rate actually is a reflection of this. The numbers that we're looking in respect of the local nurses is actually stabilizing. Our key issue and problem is that we're losing the foreign nurses. The second question related to the ideal nurse to patient ratio. This is actually a function of the type of wards and the work that they do, because it is a function of the care that is needed for the patient. And as you know, they are all tiered in terms of what specific care needs to be given. So this is a function of that too, and that is actually a priority because patient care is important. So in a lot of the settings, what we're trying to do is also ensuring that they have sufficient time to dedicate to patient care. What are the other pieces of work that they need to do? Admin work. We're looking at various ways as to how we can manage some of this work so that there is sufficient time and they are actually able to dedicate their time to the work in relation to patient care. In relation to his concern and queries with regards to the salaries, also the other workers, the healthcare workers, I think this is something that we're constantly looking at because we know how valuable they are in our community. We are concerned about the pandemic still being around and also the fact that we have an aging population. So this is something we're constantly looking at making this sector favorable one, something that's attractive, so that we can actually have people go into the sector and be and relieve the manpower on the ground. But the reality is, as I mentioned earlier, we're doing everything. It's a multi-pronged approach. So our issue that we're seeing right now is the fact that we are losing foreign nurses due to the pandemic. Now that the borders are open, they can go back. They are also being attracted by the prospects overseas. So there's international competition and we're losing all these workers. That means that we're losing the numbers on the ground here locally. So while salaries and working conditions are important and we're constantly looking at how we can improve these, we should not jump to the conclusion that they're always the root of the manpower problems. And MOH remains committed to trying to look at this issue holistically and adopt a multi-pronged approach in improving the situation on the ground.
Mr. Lewis Ng.
Just a quick last point. I mean, I do agree we have a lot of guidelines in place, but I think it's very difficult to follow at this point because as SPS mentioned, a lot of the foreign nurses are leaving and that really puts the stress now on the local nurses. So I think we can rely on their passion. They're very passionate about it, but I think they're really urging for some protection of especially their rest time. So again, I ask whether MOH can at least make sure that the guidelines on adequate rest for nurses are being adhered to at this point.
I thank the member again for his question. Indeed, I understand the concerns. And I mentioned earlier that there was an internal committee that was set up, the Staff Wellbeing Committee. And among some of the issues raised is clearly the issue of actually giving sufficient rest to the nurses. And this is something that they are looking at. There have been a few recommendations. The implementation of these different recommendations are being rolled out. And we do hope to see that these recommendations and its proposals actually impacting the workflow, and hopefully that will improve outcomes. On the other hand, there are also other things that we hope to see because I also mentioned earlier about how family members, in terms of caring for their caregivers, there's a certain expectation of what nurses are expected to do in hospitals. And this also does not help in terms of adding to their workload. the culture may be different elsewhere, and we may want to educate and look into this matter. There's also a task force being looked at to address issues of abuse, which also impacts the work conditions of the staff and the nurses. And so these are also all things that we're currently looking at. So give us some time to roll out some of the recommendations that have been put out. Hopefully, through all these efforts that we're putting up, there is improvement, and we will constantly review this to see how this has impacted on the ground.